Hi, everybody. Me again, Dr. Kathy. Sorry it's late. Had a few things to do, so I got delayed. But good to see you guys. All right, so yesterday we talked about sex, and do you really, really know how to identify your issues, right? So that's what we talked about yesterday. Today, we're going to talk about how you can talk about sex with your partner, okay? The sex talk, right? So we all know it's a little bit embarrassing to talk about sex, right? Sometimes with our partner. Sometimes it's like you're squeamish and you feel, oh boy, this is going to be difficult, right? So first of all, let's first of all breathe and know that it is really, really, really important to communicate, right? And talk about sex. The most important question is, what is your problem? What is your issue? And you want to know how to broach it with your partner, depending on the type of partner you have. So you've got to case out your partner. Yeah, there's some psychology in this, right? You've got to sort of like know when is a good time to talk about sex with your partner. So he's got to be in a good mood. She's got to be in a good mood, right? And sometimes it doesn't really come with a timetable. It just comes out of the blue, and sometimes you just want to mention it, at breakfast, at dinner, and it really is something that I think becomes natural, right? So you want to make sure that you are comfortable and your partner's comfortable, right, about talking about sex. If you bring it up and they don't want to talk about it, that could be an issue. So you want to make sure that they are okay. And you say, hey, can we talk about sex? And you might get a smile, you might get a laugh, or you might get a frown. Whatever it is, try and take it in your stride and say to your partner, I really have something I want to talk to you about, right? Okay. So you need to know who you're dealing with. Number one, if the person is the sort of person that doesn't like to talk, you might want to write it down, right? You might want to put it in an email or in a text. And I'm okay with that too. When you are communicating with your partner, sometimes to break the ice, you start off with a text. Hey, can we talk later on about sex? Right? Or I've got something really, really serious on my mind. Yeah, it's about last night. Right? So you want to sort of broach the topic as naturally as you can. But I'm going to encourage you, you must talk about sex. And I'll tell you why. Number one, we all know in that way you communicate your needs, your fears, right? The other most important thing is you're telling your partner what you like and what you don't like, all right? So let's say you were intimate a week ago and you wanted to let your partner know that there were some issues in the bedroom. So you've got to bring it up and you have to be very, very, very honest. And you have to ask your partner, is it okay to be honest? Now, if they say, oh, they don't want to be honest, they don't want to hear about it, then you just shut it down and you just keep quiet and you just walk away, okay? Because anyone that cannot talk about sex might not be the person that you should be talking to, especially at that time. You want to try it again? Sure, you can try it again later on. But it's important for you to know that communication is key no matter the topic. And if they don't want to talk about sex, it's something that's going to hurt you in the long run. So please open up the channel, try and talk. If he won't talk or she won't talk, you might need to get some help. You can reach out to a therapist, a psychologist, family doctor. You want to talk to your members of the religion, you can do that also. But the most, lovely thing is that when you are trying to communicate about sex, it means you care. It means that you love your partner. Otherwise, you wouldn't go this far, right, to talk about sex. It really helps to have a third party. Some people have their siblings, some people have their friends, some people have their aunts and uncles and grandparents, and that's okay as long as you're comfortable and your partner's comfortable too. But really, really understand that talking about sex is key and crucial, okay? All right. So when you're talking about sex, what do you want to talk about, right? You want to talk about sometimes where you're going to have sex, right? Some people have sex in different places. So if you're in a place where you're not comfortable, you might want to talk about, oh my goodness, I wasn't comfortable here, or I want to do it there, or I want to do it everywhere. You want to communicate that with your partner. Okay, so where, when is important. Some people like to have sex more than once a day. Some people like to have sex maybe once a week. So you want to communicate that and find out once a week, twice a week, how many times a week, how many times a month, how many times a year, right? Depending on your situation, you want to find out what the person you're dealing with is comfortable with. So sometimes they're not comfortable with once a week, or they're not comfortable with once a day. And so you want to open up that channel. You want to say, all right, I'm not comfortable with this because 1, 2, 3, 4, 5. And you give reasons for that. There's got to be some compromise. I remember I had a patient once. He said he wanted to divorce his wife because he said she wasn't having sex but once a month. And I said, you're on hormones, right? You're using testosterone. That's not fair because she doesn't have anything. And I knew she wasn't taking anything. And I said, bring her in. Let's see whether we can help balance her hormones. So I did balance her hormones. And next thing you know, she was able to have sex once a week, right? So sometimes you can go to your doctors to find out why certain issues are occurring. It could be a psychological issue. It could be a physical issue. It could be pain, right? So you want to talk because there are so many different reasons to sort of like clear the air and improve your sexual talk and relationship. Okay. Now, remember, I said 2 orgasms a week, you live longer. 2, you live longer. That's because the circulation is improved and you're actually getting a lot of blood flow to the brain, to the body, and you're actually getting some sort of exercise and pheromones, but you really, really feel, rested, and it's a de-stressor, and you really feel happier. Okay. So try and understand that this is something you don't want to play with, in the sense that you don't want to suffer in silence. Too many people suffer in silence. Okay. So you really want to know why you're going to talk to your partner. And guys, I'm going to put a little note here for you. Yes, erectile dysfunction exists, right? There is help. You guys can get it fixed. It is so unfair that you guys do not get it fixed. Come on, guys. Come to a doctor like me or any of your urologists. They can help you. And if they can't, come my way and I'll help you. But of course, it depends on what the issue is. And I am very detailed. I go into what your problem is. I customize your problem to make sure that your issue is addressed. And I don't care how old you are, how young you are, how old you are. Come on, you have any issues? Let's talk about it and let's fix it so that you can actually satisfy your partner and don't feel guilty and don't suffer in silence. Remember, that's why I'm talking about this. You do not have to suffer in silence. There are ways to circumvent and get around those issues and get you back functioning to the best of your ability, okay? So do not give up. I'm imploring you. Come to me, come to a doctor like me, go to your primary care doctor, see someone that can help you, because there are so many new ways of helping you now. Guys, get that erectile dysfunction taken care of. So many innovative ways to do it now. And I promise you that it won't be too painful, right? It won't be painful in some cases at all. But again, you want to satisfy your partner, please endeavor to do that by reaching out, okay? Okay. So we talked about where, we talked about why, and we talked about when, right? So that's a way of communicating with your partner. Sometimes you have to sort of like get that squared away, okay? Now, another thing you want to talk about is STDs, okay? Now, STD is my favorite topic. Whew. Now, the question people ask me a lot is, Dr. Kathy, how do I tell my partner I have this? How do I tell my partner I have that? And the answer is you just tell them, okay? Because if you don't, and it comes out later on, you will be in hot water, okay? No one likes to find out that you have something by them getting it themselves, okay? So when you transmit an STD to your partner, it is very frustrating. I'm sure we all know that. But sometimes you don't even know that you have an STD, right? So what do? I've said it before, you get checked. 5 STDs you must get checked for: HIV, hepatitis, syphilis, gonorrhea and chlamydia. I put them in one category. and herpes. Okay, so let's say you're positive with one of them, right? You are going to have to inform your partner, especially the HIV. That's a legal issue, okay? Now, when you inform your partner, I would love if you had the results of the test of the STD. And then you could be very specific and tell your partner, I'm sorry, I did a test and I have one, two, three, or what are the other STDs? And I'm really, really in telling you this because I really want to tell you to get treated to your doctor and get some antibiotics. Or you can come see my doctor. He or she will give you some antibiotics too. Okay, so very important to just call the person up. If you can't call, send an email, send a text. I've had patients do that too. But reach out and inform your partner, all your partners that you've been in touch with sexually, so that they have a chance to get treated because it'll spread. And we're trying so hard to stop getting resistant STDs. Okay, so that's a very important information that you must have. Try and inform your partner so they can get treated and knock it out of the park, so that we can go back to having sex in a healthy way. Otherwise, you can damage your tubes, um, damage the chances of having babies. So you do want to make sure that you are fair and tell your partners whether you have an STD or not. And again, if you're not sure, get tested. Those 5 tests, get tested. Okay. Okay. Another thing you want to talk about is what you like and what you don't like in the bedroom. Okay, that's a biggie, right? It depends on how experienced you are or how not experienced you are. If you're a virgin, right? If you've had 200 partners, I had a patient say, "Oh, Dr. Kathy, I've had 200 partners." I'm like, okay, that's a lot of partners, right? But the most lovely thing about communicating about what you like and don't like is that you really do get an opportunity to tell your partner what works for you and what doesn't work for you in terms of your orgasm. Okay. Now, if you don't have an orgasm, you're not going to know what really helps in terms of your orgasm, right? So your orgasm is going to have to be sometimes learned, right? It's not sometimes immediate. So you might have to get to know the person, get to relax with the person, and then eventually your orgasm will come. So the key is relaxing. Now, guys and girls, you've got to realize that everyone's orgasmic potential is different. Okay. The number one thing I always check is the hormones. Have your hormones checked if there's a problem, right? It's an issue with getting an orgasm because you go through the change, that's going to change the orgasm frequency too. Guys, for you too, also, right? You're going to have some changes too. Get that testosterone checked. Women too. So, whenever you are actually having that conversation of the orgasm, you can ask how many partners you've had. Some people say the body count, right? I don't think it's relevant at all, but some people want to know so that they know their experience, right? And that's a legitimate, question. But otherwise, leave it alone, okay? What matters more is, did the person have orgasms before? Okay? I've had some patients have, several relationships and they've never had an orgasm. And so you want to know whether you're going to have that obstacle in terms of trying to make someone have an orgasm. And I don't think the orgasm has to be the number one focus, especially the first few times. It takes time for people to relax and get to that peak. So be patient, ask, talk about it, their past history, just to find out how you can please them in the current situation, okay? All right. Scared, have some fears. Everyone does. So that's a given. If you need to get something for anxiety, please get something for anxiety. There are natural supplements over the counter and there are prescriptions too. So anxiety will knock out your ability to have sex. So all y'all, men, women, all consenting adults, this is for consenting adults, make sure you get that anxiety taken down, all the way down. And, you do things like alcohol, marijuana, it knocks out your sexual function. So I'm not really sure that you should do that. Maybe a little bit, but not a lot of alcohol. Some people like to use weed. Again, to each your own. Make sure you're doing it safely. Make sure you're doing it legally. And my recommendation is to be healthy. You really want to do it without it, but I know sometimes you do that. So, but if you do it, be careful. Do not overdo it. I think that would cover a few topics for now. I'm going to come back and address that again tomorrow. We have a lot more to talk about in terms of what you can talk about in the bedroom. But I think if we can take home the most important point, which is you have to talk about it with your partner. Where, when, why. Just use that and try and open up that conversation by saying, hey, let's talk about sex, or let's talk about this that happened last night, or this that happened last week, or is it okay to talk about it? Those are the few ways I would start or approach the conversation. But please know that it can really help the relationship, and it can be a turn on for some people that when you bring it up, it's like, oh my God, she's confident or he's confident and he cares, right? Very important to remember that and try and open that conversation as much as you can, okay? All right, guys. Nice to talk to you. See you tomorrow. Have a good night. Bye.